Just great. So welcome back to the third session of the 2023 Oregon Reference Summit online conference. I'm Lauren Arnold, the Collection Development Manager at Jackson County Library Services, and I will be your moderator for the section. Those who are attending, if you haven't already, and I see most have, please take a moment to mute your microphone. We are going ahead and saving questions for the end of the presentation. That being said, throw your questions in the chat at any time. I'll make sure those get read aloud. You can also raise your hand and just unmute yourself when we get to that point as well, depending on what you feel most comfortable with. So our next presentation is Consumer Health Reference, an introduction to ethics and best practices. Our presenter is Carolyn Martin, Outreach and Education Coordinator at the Network of the National Library of Medicine. Just, you know, this is a 15-minute long session. And like I said, we do have Q&A at the end. So Carolyn, please take it away.
Thank you, Lauren, and thank you for the opportunity to share with you some guidance in providing health information to the public. You probably already know some of what I will be presenting, but I also hope that you will be able to gain something as well. And I'm going to warn you, I've had a bit of a cold, so I may cough now and then, and I'm going to turn off my camera if you don't mind, and then I'll turn it back on again during question time. Let's see. So let me first tell you a little bit about my organization, the NNLM. We are an organization of acronyms, as you can see, and some of these may or may not be familiar to you. The National Institutes of Health is the nation's research agency. Many of you might be more familiar with the National Cancer Institute, which is one of the many institutes and centers at NIH. The NLM, or National Library of Medicine, is one of those 27 institutes and offices at the National Institutes of Health. It is the world's largest biomedical library and produces online resources like PubMed and Medline Plus. The NNLM, the Network of the National Library of Medicine, is an outreach program of NLM, working to ensure health professionals and the public have equal access to health information. NNLM is made up of 7 regional medical libraries and several national offices and centers, all providing training, funding, and engagement opportunities, all for free. My region, Regions 5, operates out of the University of Washington Health Sciences Library and serves Alaska, California, Hawaii, Nevada, Oregon, Washington, and the U.S. territories and freely associated states in the Pacific. I'll be covering some of the basics of providing consumer health reference and give some context. And we'll also mention a little bit about health literacy, health misinformation, evaluation, and professional development. The information in the session is compiled from these associations and the NNLM. These associations either provide a code of ethics or conduct or guidelines to help with library services, including health information. And at NNLM, we have a lot of expertise and offer free classes and resources focused on health information. Your library may be asking a variety of health information questions. They may be concerned about a public health issue highlighted in the news or social media, or perhaps they are students doing research for a school project. They may be looking for information about a disease or health condition or treatment for themselves or someone in their care. Navigating our way through the healthcare system requires the ability to read, listen, analyze, and make decisions in an area that is very unfamiliar to many of us. And many times we have to do this when we are feeling unwell or anxious, which is why it is so important to provide a quality health information reference service. Health questions come with many opportunities and challenges, and no matter how prepared you are, patrons will inevitably ask a question for information that you have never searched for before. One simple first step is to present your library as a welcoming and safe space. Library hospitality at its best. Treat everyone with respect, set aside your personal, religious, and political values and opinions. Be aware of your verbal and nonverbal communication norms, which often differ by culture, community, or individual. That said, here are some general ideas to keep in mind. Stay calm and keep your emotions in check. Try not to make unnecessary noises or comments like sighing or saying something like, "How awful." Stay aware of your posture, your tone, facial expressions. A patron might be asking a question and they clearly feel embarrassed to ask, so keep your expressions neutral as you listen closely. Try not to cross your arms and look startled like the person in the first photo, but rather like the photo below, where there's a kind face ready to listen. Keep in mind that health issues can be stressful. Someone might feel angry, sad, confused. This can impact how they ask for and process information. If someone is upset, their thinking might be more fixed and inflexible. They might be wishing for a quick answer or a solution to their complex question. The information the person is looking for might differ by age, gender, literacy level, socioeconomic background, culture, or language, and other factors. It is very common to feel intimidated by the topic or the question the patron is asking, and to worry about providing the wrong information. Many of you have probably experienced some of the unique challenges of health reference. For example, a patron might tell you something very personal. They might, or you might, feel strong emotions during the interaction. How library staff respond to the patron can help them to feel comfortable in the moment or allow them to the space to return if they aren't ready to get all the information they need in one interaction. When a patron asks a question that's potentially sensitive, lower your voice so that it's not easy for others nearby to overhear the conversation, even if the patron doesn't seem to care and is talking loudly. If possible, consider leading the patron to an area of the library where you can talk without being overheard. This might be in the stacks where you have books on the topic, a quiet corner, or perhaps a study room or an office. And if possible, slow the interaction down. It's okay to take a moment to process what they've said before you begin looking for the information. You might say something like, "I need a moment to think about where to begin looking for information on that." I know slowing down the interaction isn't easy, and especially if the library is busy. You might want to consider setting the patron up on a computer and getting them started, and then checking in with them to ask about what they found and if they have any further questions. Don't discuss the interaction with staff unnecessarily. If you need to ask for help, be sure to ask the patron first, if it is okay to ask another staff member who might be able to also help. The patron may not want to include another staff person because they want as few people to know, or they may have had a bad experience with another staff member, or maybe they know some of the staff personally. Honor the patron's response. And once the interaction is done, shred or delete any documents that may have the patron's information. Consider some active listening tips in your reference interactions if you don't already. One technique is to stop what you're doing and breathe, and then you're ready to listen without interrupting while keeping your verbal and body language in check, like I mentioned earlier. Then you're ready to respond by being kind and patient and asking open-ended questions. If the patron tells you they've received a serious diagnosis, it is okay to express empathy. However, be clear about what your professional boundaries are. You provide information. You cannot provide the patron with medical advice or emotional support. Know when to refer a patron to their healthcare team or social support services. Do not share your anecdotal stories to demonstrate that you understand. This may convey the wrong message. Each situation and person is different, and respect that difference. Your role in the library is to provide information, not advice. It is important to keep personal information confidential. Stay neutral, listen closely, and remain compassionate. Keep the focus on the patron's question and the information they need to learn about the topic. It can be helpful to know the purpose of the information. However, asking this can feel super personal, so don't feel like you need to ask if it doesn't feel right. There are many categories of health information, including treatment, prevention, causes. Asking about this can help narrow the search. For example, if someone is looking for information about Alzheimer's, you may ask, what could be helpful to you? Information about treatment, caregiving, or something else? Do they just need a simple fact sheet, or do they need a medical study? What language or format would be best? Some resources offer information in languages other than English. Do they prefer information they can listen to or to watch? And during the reference interview, you might need to ask questions to get clarification, and try to ask open-ended questions. You might ask, what do you already know about this topic? What kind of information on diabetes are you looking for? Symptoms, prevention, nutrition? Would you like to tell me more about this topic? Or what do you already know about this condition? And this can be particularly helpful if it's something you don't know about. Can you tell me a little bit about who this information is concerning, such as a child or an older adult? Where have you looked for information so far, so that I don't retrace the steps that you've already taken? Clarify that you have the correct terms and spellings. This can make a huge difference. For example, does a patron need information about hyperthyroidism or hypothyroidism? Verify that you have the correct one. You may need to ask the patron to ask their doctor before proceeding. Don't guess. Provide information from reliable resources. I'll give you some examples on these resources in just a bit. And when reviewing health information of any type, you might tell the patron why you trust it or why you don't. I'll also mention this a little later. If you cannot find reliable information on the topic, you don't need to provide that information. Refer the patron to their healthcare provider or contact a local hospital or health sciences library for assistance with the question, which I know is an option that is limited depending where you are located and what your patron might prefer. You do not want to provide substandard health information, just like you wouldn't want your doctor to provide substandard health care. It's common that patrons have heard that health information online can't be trusted. So they ask for a book, or they ask for a book because they want to take it home and read it. And in that case, if you don't have a reliable book on the topic, be honest and tell the patron you don't have books on the topic and that there is reliable health information online. You'd be happy to help them locate reliable information and print it for them to take home. I think some of the best health information we have is available online, but also some of the worst health information we have is available online. Reassure the patron it's your job to help them find the good information. There's also a learning opportunity here with your patrons. Let them know how you evaluate information and that they too can evaluate the information they come across, no matter what the format or topic. How many of you already use Medline Plus? And you can either raise your hand or put it in the chat. And I'm not able to see very well. Good. I'm glad that some of you have heard of it. This is a National Library of Medicine resource, and it is a good one to include in your library's list of resources. It is a good place to start as it has information about health topics that is organized in a way that makes it easier to find the information. You can also use the search box, and the results are all from within Medline Plus, and you'll find information on health topics, medications, herbs and supplements, information in different languages, and more. Some of your patrons dislike government information. That's not uncommon. In Medline Plus Health Topics, you will see where the information is coming from, and you can go directly to that medical association or service organization instead. And as you become more familiar with Medline Plus, you may notice websites often listed, and you can go directly to those if that would make the patron more comfortable. There are a few ways to search on Medline Plus. You can do what many people do and use the search box, which is in the top right corner, and it will create a list of results similar to doing a Google search, but all the results are from within Medline Plus. You can also use the alphabetical list here to search by topic, and you can also use any of these categories down below. Sometimes you may want to see if there's more than one topic that is on a similar topic that are related, and you can see that within some of these different categories. Both the alphabetical and the categories generally link you to a health topic page, which is neatly organized, and I'll show you that here in the next slide. This is an example of what a health topic page looks like in Medline Plus. This one is on Alzheimer's disease, and it starts off with a table of contents that you see here, and you can click on those sections and be taken directly to them, or you can just scroll down the page. As you scroll down the page, you can see a summary, and you can see where to start, information that takes you to about symptoms and diagnosis and treatments, as well as more specific information such as living with or related issues. Also note that you can see where the information is coming from, and it's good to have a variety of quality resources referred to than just one author. It also saves you time from going to one website to another, as it is all vetted and organized for you. The National Institutes of Health also provides health information for the public and for students. And you can find that here in this Health Information tab. Most of the information is all here put in one area, but you might also want to go to each of the individual institutes, and almost all of them, and that's located right over here on this tab. And almost all of them have a health information tab for the public. And also, you might be interested in the NIH News and Health newsletter that comes out every month. This is something that you can link to or download and print and make available to your patrons. It's a good idea to remind your patrons and yourself to always evaluate the information, even if you feel it is from a trusted source. It's a good habit to get into, and Medline Plus has a whole health topic page on evaluating health information that you can share with your patrons. Evaluating health information is one way to increase health literacy, which can have a positive impact on health. The consumer health books relied on by many libraries in the past are harder to find as the internet has become more widely used. Professional medical associations, such as the American Academy of Pediatrics website, sometimes have publications for purchase, or organizations such as the American Diabetes Association or NAMI, the National Alliance on Mental Illness, may have some items such as brochures and tools to purchase and offer your patrons in a program or just to hand out. Many government agencies have items you can either download or order for free, and this may take a bit of searching, but you'll be surprised at how many provide free booklets, fact sheets, and brochures. In your already existing collection policies, you might want to consider adding a sentence or two addressing health information materials, or even having a separate policy. Your collection policy, whether the general one or a separate health information one, can state what will and what won't be provided. For example, one library states, our staff have committed to provide trustworthy consumer health information to the community in a variety of formats. The goal is to make it easier to find current, authoritative, and evidence-based information for all library users. Libraries do not want to be part of the health misinformation problem, but rather part of the solution. NNLM has a number of information guides, including one specifically for public libraries, but it is really for any library organization providing health information to the public. And here we have sections in that guide on health information resources and a section on collection management that provides some guidance, including links to resources. When delivering the information to the patron, keep focused on the patron's information need and your role in the interaction. You are an expert in finding information, not in helping the patron understand their health. You cannot diagnose and you cannot prescribe. If reading the information, use a calm, kind, but matter-of-fact voice. Read the text as it is. Do not interpret or explain, and do not withhold information. If you feel the information may cause the patron distress, you could say something like, this may contain some information that may be difficult to know about or understand. You'll probably want to take it to your doctor who can discuss it with you. You can offer the patron some private time, a box of Kleenex, or other small acts of kindness. If using print materials, please remember to print or photocopy the front matter, which includes the copyright date, title, author, editor, publisher, ISBN, etc., so the patron knows the source of the information. And always refer patrons to their healthcare provider if they have questions about the information you're providing. There are ways to inform your patrons through teachable moments. While you're searching, you can think out loud to show how and why to explain your searching method. When selecting items, online or physical materials for the patron, say a few words about why you like the resource by pointing out some things like it is research-based, that the American Heart Association is the publisher, that it is newly published. Maybe the patron is wanting a specific diet book that is a bit outdated. If your library has it for some reason and the patron insists on checking it out before you can weed it out, go ahead and let them have it, but then say something like, there's information about other nutrition diets you might be interested. Let's go visit My Plate website with recipes and tools you can use for free. If you like, I can print some of the information for you and you could take a look at it on your own time. So I've given you a few tips about how to do health information, and I thought it might be good to do a little scenario and think about it, and we'll then discuss it here in just a bit. So I'll go ahead and read it, and you think about what the library staff are doing well and what they could do to improve. So let me start that one. Library staff. Hello, how may I help you? Patron. My sister has just been diagnosed with breast cancer, and she's being told she needs to have a mastectomy. But I didn't think that was usually the first line of treatment, so I want to find out what her other options are. Library staff. I am so sorry. What a terrible thing to happen. Cancer is the worst. Patron. Yes, it is awful. Patron starts looking worried. Library staff, who continues speaking loudly while not paying attention to the patron. You know, if the doctor says she needs to have a mastectomy, most likely that's what she should have done. The doctor knows best. A friend of my mother's decided not to have one, and she ended up dying a lot sooner. But I'm so glad you came to the library. Now, what was it that you were wanting to know about this cancer? So take a moment to think about that. And in the chat box, you can write in what you think the library staff has done correctly. And don't be shy, but I know it does take time to think about it. Yep, being compassionate, expressing care with "I'm sorry." Yep. Now let's take a moment and think about what they could have done to improve the interaction. Yeah. Too much about their own experience, right? You need to center on the patron, use a quieter tone. Yep. Mindfulness of the situation. Yes. Being focused on the patron there. Yeah. A private location would be helpful. Yes. Yes, they shouldn't be providing commentary. That's right. Most likely the patron already knows that is not a good situation. And, you can take some moment to think about these. If you ever have an interaction like this with a patron, about health information, whether you thought it went well or it didn't, you can take a moment to think about that and reflect about how you could have improved it or what did go well. And this is just one way to help improve your interactions. I have another one. I think we have time to go over it. Okay, so this is the second scenario. Again, we're going to look at how the library staff did a good job and how they could have improved. So I'm going to read it. Library staff, hello and welcome. How may I help you? Patron, I'm looking for a book on Prader-Willi syndrome. Library staff, Willie Prada, what? It's a genetic condition, the patron says. I don't really know much about it, which is why I'm here. I thought the library might have a book or something about it. The library staff, I'm so sorry about how I reacted. I haven't heard of that before, and I'm not sure we'd have a book. I will try my best to find you some good information. Would you mind if I ask you some questions just so I can help you find the information you are wanting? So let's again look at what the staff did well. And you can put those comments in the chat box. Apologizing and moving on. Yep, then getting restarted. Yes. Even though you realize that you may have said something wrong, it's okay, and it's actually very good to admit it and to apologize for it. Moving into a good reference interview. Yep. Yep. And this is something that you can, again, like I mentioned earlier, that you can do in an in-service or just on your own, reflecting about your interactions with your patrons on any topic. And it's just a good way to, not berate yourself for what may have gone wrong, but just to take it as a learning opportunity. Okay, I have a few more slides here. And I just wanted to include a little bit about health misinformation, as this too can be part of reference. As many of you know, throughout the COVID pandemic, many people relied on the internet for information and for social connection. The need to know how to evaluate health information is not new, but the COVID pandemic has emphasized an ever greater urgency to equip the public with tools and knowledge to help navigate their way through the vast amounts of information bombarding them every day from the news, social media, scams from family and friends, causing what was labeled the infodemic by the World Health Organization. Even with authoritative resources, information changed from one day to the next. It was hard to know what to believe and what to do. And this can be true of any health crisis or even your own personal health. Our human nature wants certainty, and we don't like change. Science takes time, and information changes as researchers learn more. Health misinformation has become a crisis and threatens public health. The U.S. Surgeon General published a 22-page health advisory asking journalists, the tech industry, government, and other institutions, as well as the general public, to take responsibility and do what we can to slow the spread of health misinformation. How can we do that? One way is to simply not continue the spread of misinformation. Your friends or family may share with you some news that don't meet the evaluation tips mentioned earlier. No need to pass that questionable information on to others. Another way is to engage and listen and ask questions. You could say something like, I've heard many people believe that. It can be scary and confusing. I've been using this tool I heard about at a conference called Trust It or Trash It, and I find it helps me know what information is more authoritative and you might find it helpful too. This toolkit provided by the U.S. Surgeon General's office can help guide you and your library when working with patrons. There are examples of phrases to use, what not to say, and tips to help everyone better understand the information they are finding. And you can even provide a program as a slide presentation is included. Your libraries probably include publications by celebrities about health. Some celebrities, as you know, like to think of themselves as health experts. Many people will follow a celebrity's advice rather than their medical provider. And I would encourage you to watch this BMJ video. It's about 15 minutes long. And though it is from 2013, it provides greater understanding about when we shouldn't be following celebrities' health tips. For example, if a celebrity is working as a representative of, say, the American Heart Association, that is very different than just sharing or stating their own opinion and experience. A couple of good books to learn more about this are also on this slide. One of them is Gwyneth Paltrow Wrong About Everything? And the other is called Bad Advice, or Why Celebrities, Politicians, and Activists Aren't Your Best Source of Health Information. And unfortunately, we can't always trust all doctors. Some of them have also spread health misinformation. Oops, back. So it is a good idea to remind your patrons again and yourself to always evaluate the information using Medline Plus evaluation information, or this tool called Trust It or Trash It. This consists of 3 questions that might be easier to remember than some of the other tools. Though the web page lists an older date, this tool is still a good one to use. I know health is not the only reference topic you receive, and keeping up on it probably isn't easy. These are just a few resources you might look to. The programming librarian has great ideas for programs, and you can limit it to a health category and share your program ideas here with others. Here at the NNLM Region 5, we have a newsletter that goes out every week called the Weekly Digest, and you can subscribe to that and learn about classes and news and highlighted resources through that. Most of you probably aren't subscribed to the Journal of the Consumer Health on the internet, but you can access the table of contents and order articles through Interlibrary Loan. And though this health literacy listserv isn't specifically for libraries, I have really enjoyed it because it does provide lots of tools and resources on there and great discussions. And I also wanted to tell you our classes are all free and you can find them offered in a variety of formats. Some you can attend live, like a live webinar session, whether for a particular class or whether we have a guest speaker. Moodle classes can be completely on demand where you can work at your own pace. And some Moodle classes are scheduled for a range of time to be completed on some asynchronous time frame. If the class is a webinar, they are recorded for you to view on your own time. And they do provide a Medical Library Association C credits. Our consumer health classes are eligible towards the Medical Library Association's Consumer Health Information Specialization, also known as CHIS. You don't have to be a member of MLA to get this. And currently, NNLM is taking care of the application fee, so it is free to you and good for 3 years. So consider taking relevant classes and possibly working toward this specialization, as it can help you gain the knowledge and expertise to provide health information reference and programming confidently. And know that your library can help improve the health in your communities by providing quality health information, using teachable moments to improve health literacy, to bring awareness of health issues, and help stop the spread of health misinformation. I know I've repeatedly said that we are not to give advice or recommendations about health, but we are the experts regarding information resources. It is our responsibility to provide the best possible information from the best possible resources to our communities. And I have a little quiz here at the end if you would like to participate. These questions are all true, false. You can either put a T or an F in the chat box or write the words out. And it's just for fun. So don't feel like you have to participate, but it's just a way to kind of review some of the information I went over. So the first one is, to show patrons you care, tell them a little bit about your similar health experience. Is this a true or false statement? False, that's right. It's best not to tell them about your experience as much as it's easy to get into, because you just want to show that you care and that you can relate, but it's best just not to share that information and to focus only on the patron and their need. Keep the patron's health information request on file just in case they come back another day. True or false? False, yes. As much as you might want to keep that, whether for helping yourself learn about it, a topic or whatever, it is best just to go ahead and delete that or shred the information to keep patron confidentiality and privacy in check. Medline Plus is a trusted and authoritative health information resource from the National Library of Medicine. True or false? True, yes. It is a good one to start with, and it includes resources from a variety of online organizations that have been vetted and are all compiled there for you, but you can also go to those other ones individually. Libraries know best when it comes to doctor recommendations. True or false? Yes, it is false, because it is best that we are not to give recommendations either about a doctor or a hospital or even treatments, but we can provide recommendations of resources that may have information about doctors, but we cannot recommend doctors specifically. And the last question, let the patron know they should contact their doctor to explain how the health information you provided applies to their situation. True or false? Yes, yes. This is always a good idea to say that. When I worked as a hospital librarian and provided information to patrons, I would say, if you have questions about the resource that I'm getting this information from, you can talk to me. But if you have questions about the content, about the health information itself, please talk to your doctor or your nurse or whoever is providing the care. So thank you, everyone. And if you have any questions, I'm happy to try and answer those as best I can. And if you don't have any right now, you can always contact us. We're happy to provide any information about classes, or we can also provide training as well for your libraries. And you're free to use any of our resources because they're all free and through the federal government. So we don't have any proprietary claim on any of it.
Thank you very much, Carolyn.
Sure.
That was incredibly helpful. Really appreciate it.
Yeah, no problem.
Just to let everyone know, we're about to go on break. So lunch break start now. And then it runs